Just introducing you about the global prevalence of adolescent mental health. We're going to talk about the global prevalence of adolescent as far as the mental stress is concerned. I'm just going to speak on the key statistics. 1 in 7 adolescents between 13 to 19 years globally experiences a mental disorder with the depression and anxiety, which is the leading cause of illness and disability. These are WHO figures of 22. 50% of mental health conditions start by age 14, but most go undetected and untreated. These are WHO figures. UNICEF, again working on children and adolescents, says that 1 in 5 adolescents between 15 to 19 years report feeling of constantly worried or nervous. If girls are disproportionately affected, 35% report chronic stress in comparison to 30% as for the boys are concerned. As far as the Lancet publications are concerned, in 2023 it said that by 2030, mental health disorders, especially stress-related, will cost the global economy $16 trillion annually. $16 trillion annually due to lost productivity and healthcare cost. As about the impact of gynecological and reproductive health is concerned, because of this, stress and menstrual health are well known. In 2023 meta-analysis of Journal of Adolescent Health found that 40% of adolescents with high stress report irregular menstrual cycles and worsening conditions like PCOS and dysmenorrhea. Chronic stress doubles the risk of developing premenstrual dysphoric disorders, PMDD. As for the sexual and reproductive outcomes are concerned, stress correlates with a higher risk sexual behavior, that is unprotected sex, multiple partners, due to impaired decision making. This is again statement by WHO released in 2022. Adolescents with anxiety and depressions are 3 times more likely to experience unintended pregnancy. As for the pregnancy and postpartum period are concerned, the mental health disorders in pregnant adolescent increases the risk of preterm birth by 12%, low birth weight are again 10%, postpartum depression to the tune of 25%. This has been reported from VMJ 2023. Now, what are the actions and strategies for gynecologists? Screen proactively. There are screening tools available. PHQ2, PHQ9, this is for depression, and GAD7 tools in routine checkups to identify anxiety and depressions early. As I said, PH2 and 9 are for depression and GAD7 is for anxiety. Address menstrual problem by telling them when to seek doctor's help. Now, this is about PHQ. There are simple tools available. The simple questions we asked, frequency of your depressed mood and the loss of interest or pleasure in the past 2 weeks. And if patient screens positive on PHQ2, then they are typically evaluated on PHQ9. Again, PHQ is a questionnaire, so you ask a question again, how many episodes in the last 2 weeks, and can be used for both screening and diagnosing depression as well as monitoring treatment response. As for the GAD7 is concerned, the purpose is assess anxiety disorders, generalized anxiety disorders, GAD, and the questions about frequency of various anxiety symptoms experienced in the last 2 weeks. These simple tools, not complicated, can be used right in the school health. Now, we must get congratulated. Today we made a logo for all of us, and this is for Adolescent Health Ambassadors. It is applicable to both Delhi Gynecologist Forum as well as NIGF members. This is the logo. I'm going to present 10 key points highlighting the adolescent mental stress in Bharat, along with relevant figures and an action plan tailored in our country needs. The facts are rising mental health burden. It's a fact that National Mental Health Survey, which has been done in 2015-16, around 7% of adolescents from 13 to 17 years in India suffer from mental disorders. And the action can be implement mental health screening, that is PGQ 2 and 9 and GAD 7 in schools from class 6 onwards through trained counselors. Academic pressure and parental expectations. Again, the NCERT 2021 reported 80% of students across classes 8 to 12 feel academic stress. And action is integrate life skills and stress management modules in school curricula aligned with the national education policy. And you can see that for the last many years now, PM Modi is also addressing adolescents prior to annual examinations. And now this time he has made many other personalities also to do the same. Digital overload and social media is the fact that 1 in 4 adolescents report spending more than 4 hours per day on social media, affecting sleep and self-esteem. Action is promote digital literacy and awareness program for students and parents about safe online behavior and screen time on limits. Here, I just wish to tell you this time the boy who stood first in IIT exam is a poor boy from Orissa. And when he was asked, what is your one message to give to the rest of the people in the country how to study? And he said, the only one message I wish to give is not to have a phone, not to have a phone, not to have a phone. This fellow is scored 100 out of 100 marks in IIT. Bullying and peer pressure. According to a study of UNESCO, 42% of Indian students of secondary schools reported being bullied. Enforce anti-bullying policy in schools with a peer support groups and grievance redressal mechanism. Suicide, Pancham is going to present a grim reality as far as National Crime Bureau reports in 22 that over 13,000 students committed suicide, and majority had been from Maharashtra, Tamil Nadu, Madhya Pradesh, had the highest numbers. Action establish a toll-free adolescent-specific mental health helplines in all states and link them with local services. Gender-specific challenges are also far too many. Girls face added pressures from early marriage, body image issues, sexual harassment, and social norms. Action is gender-sensitive mental health sessions in school and a safe spaces for girls to share and seek help. Lack of trained mental health professionals. I told you just now that in India has one psychiatrist for 1 lakh population. Even fewer adolescent mental health specialists. So the government of India is planning to train school teachers, ANMs, and Anganwadi workers to become mental health first aid counselors. COVID-19 worsened the crisis, and post-pandemic data shows 20 to 30% rise in anxiety, depression, and sleep disorders in teens. And action is include post-COVID mental health recovery sessions and regular checkup in schools and in community level. Substance abuse. You'll be surprised to know that 3 crore Indian under the age 18 use alcohol, tobacco, or drugs. These are studied by the AIMS, Delhi 2019. Action is community level awareness, role model campaigns, and stricter enforcement of tobacco, alcohol law around school compounds. Silence, stigma, and a lack of dialogue. It's a fact that more than 60% of adolescents never seek help due to stigma and a lack of awareness. Action is normalize conversation through nationwide campaigns like Man Ki Baat for a Yuva Month, involving celebrities, teachers, and doctors. Thank you very much.